5 misconceptions about phase 1 orthodontic treatment. Number 1, just because we do treatment in 2 phases means that the first phase went bad, or that it wasn't successful, or there was a problem. So the reason why we do treatment in 2 phases is because each phase is going to have individual goals that can't be achieved all together in one phase. So for example, in phase 1, one of the things that we can do is we can help with underbites. So we can actually pull the upper jaw forward orthopedically with headgear, and that's something that we can do more successfully when children are younger, and that's not something that can be done really successfully when kids are older. Also, having an underbite, for example, could cause damage to the permanent front teeth. So if it's not addressed early on, then that damage can end up being more costly and more problematic later on. So that's a specific goal that we do just in phase 1, is the growth modification. This is just an example. But I can't get all the teeth to fit together and to look the way they're supposed to when the child is 7 or 8, because they haven't grown and they haven't matured to the point where they have all their teeth. So different goals that have to be completed during different points of development. That's probably one of the main reasons why we do treatment in 2 phases. Number 2, the second misconception about early orthodontic treatment, phase 1 treatment, is that everyone who comes to an orthodontic evaluation while they still have baby teeth gets phase 1. That's not true. The greatest majority of patients who come in when they're 7, 8, 9 years old don't need any treatment at that age. We do a thorough exam. We make sure that everything's developing the way it should be. We make sure all the teeth are present, everything's coming in the way they are. We maybe start talking about when the optimal timing would be for orthodontic treatment to just try to do 1 phase. That's what most of the patients end up with when they come for a consultation early on. Now, probably less than 25% of the time we discover things that are problematic and would require early intervention, and those patients are the ones who get a phase 1 treatment. So that's number 2. Number 3, my child still has baby teeth. If we wait until all the baby teeth are out and the permanent teeth are present, which in general tends to be about 10 to 13 for most children, by that time there's going to be missed opportunities for correction that isn't going to be available when they're 10 or 13. There's certain things that are only going to be possible when kids are 7, 8, 9 years old that we won't be able to correct as effectively later on. Also, there could be damage that's been done to teeth. There could be teeth growing where they're not supposed to be. So that's why the early monitoring is so important. Number 4, doing early treatment, phase 1 treatment, is going to make it so my child doesn't need treatment later. I'll tell you this, most of the time when we do phase 1, kids will need some sort of treatment later on. And that's, again, because when we're doing phase 1 treatment, we don't have all the teeth. We can't make them all fit together. We can't get them all lined up to look the way they're supposed to. That's not the goal. The goal is to get the jaws lined up correctly, to make sure that there's no trauma that's being done to the teeth while we're waiting for those permanent teeth to come in, to make sure that the teeth are growing in their correct position and that there's enough room for the teeth. Another thing that we take into account very seriously is the airway. When we have younger children that are 7, 8 years old, they come in and we talk about whether that child is mouth breathing or snoring or grinding their teeth at night, for example. Those tend to tie into airway issues, and that would also be a consideration for doing early expansion, for example. Number 5, the orthodontist wants to do 2 phases of treatment just to make more money. That's not true. What we want to do is we want to provide each and every patient with a treatment that's going to provide the most value long term. What does that mean? Does that mean that 2 phases of orthodontic treatment is going to cost more? Yes, it's going to cost more. But the reason why we're doing it is to add value, to prevent damage to teeth, to prevent jaw surgery later on. There's growth modification that we can do to direct growth that can only be corrected later on with jaw surgery. Also, we try to do things early on that would not require tooth extraction later on. Or, for example, if there's a tooth growing in the wrong position and we can address that early on, then there's other types of surgery that your child could avoid. So there's a lot of misconceptions about phase 1 treatment. The bottom line is I strongly advise, and we as a profession strongly advise, an orthodontic exam, an orthodontic evaluation with an orthodontist beginning at the age of 7. And that's when we can start evaluating to see what the best treatment options are for your child. The earlier that we see your child, the more options we have, and that is in your best interest. So if you're interested in discussing the benefits of phase 1 treatment, if you have a child who doesn't have all their permanent teeth, I'd love to talk to you. Please call our office and schedule a consultation or message us on any of our social media platforms.